about the, so we come to the turning procedure as such. Now, in order to prone a patient, the turning procedure is a 3-step process. First, you move the patient horizontally in the supine position. The next is bringing the patient to a lateral decubitus position. And the third is actually proning the patient. We'll go through it step by step. Now, if you look at this image, you'll understand when it's a 5-member team, how these patients are to be, how the team members are to be positioned. The person at the head end is the doctor or the respiratory therapist. The person who is at the head end is typically the person who is giving the verbal orders. It's also the person who has control over the endotracheal tube. Now, it is, if you look at the first image here, you can see how important it is to securely hold the endotracheal tube in position. Yes, you have secured it with Dynaplast, a tube tie, everything. However, this doctor or the respiratory therapist's hand on the tube should not move till the patient has completed proning. So you hold the tube in position either between the thumb and the forefinger or between the forefinger and the middle finger. The other hand supports the back of the head. This other hand can move, but the hand holding the tube and the chin should not move from the beginning of this proning procedure till the end. This is a very, very important role. Now, the rest of the people, the 2, 3, 4, and 5 are variable. According to the NHS, what they recommend is that the person on the right is the one who has a view of the monitor, pumps, and ventilators. So they are the ones who can give feedback on the orders and feedback on the status of the pumps. The person on position 3 is the one facing the, the one next to the pump and the monitor and the ventilator. So this is the person who can follow any command given in order to change anything for the pump ventilator. 4 and 5 are the people who predominantly bear the weight and help in proning the patient. Please understand that proning as a procedure can cause a transient hypoxemia for various reasons, from secretions pouring out, the procedure itself. There's a risk of a short tube disconnection and multiple such things. So it's better to have the patient at an FiO2 of 100 just before you start proning the patient. So this is how you prepare the patient. You use multiple pillows. The first image has 3 pillows. You can place another set of pillows on top to bring them all to one level. The first set of pillows goes above the chest, the second set on the thigh, and the third set on the shin. The abdomen will not have pillows. The idea is for the abdomen to be unsupported and free. Once you place the pillows, you place a sheet over the pillows and you make a tight roll on either side. Now, the reason you make this tight roll because with the help of this, you can pull and prone the patient. There'll be a video that will follow. It'll be self-explanatory. So like I said, you have a tight roll. Now you can see this is a 5-member team. Once you've created that, so you've prepared the patient, you've got the tubes ready. The person at the head end is holding the tube securely. You brought the sheet over, made a tight roll. Now it's the step 1, which is the pulling the patient horizontally to the side. I'm sorry, the images have become reverse in order. So the one below is actually step 1, where the patient is pulled to the side. So here you can see the patient is going to be turned towards the right. So he's being pulled towards the left. So once the patient is pulled towards the side, the orange, I'm sorry, I'm not able to show you, but if you can see the lower image, there is the orange sheet which is visible. Now over that orange sheet, you place the fresh sheet for the patient. Then the patient is brought into lateral decubitus position. And after this, the more important thing happens, which is, please understand that following the lateral decubitus will be the third part where you will actually prone the patient. Now, when the patient is in the lateral decubitus, both the supine and the prone parts are visible. Now, this is when you have to act very fast. The person facing the chest has to quickly remove all the chest leads, ensure that the ventral surface is completely clean. If there are any tubes going across, that should be removed or repositioned, because once proned, then the patient is going to be on all of this. So if there is a lead poking into him, if there is a tube going across, he's going to be lying on this for a duration of 12 to 16 hours. One is the pain, the discomfort, and the risk for pressure sores. So once the patient is a lateral decubitus, we remove all the leads and the tubes, anything that is going. At the same time, the person facing the ventral surface the patient facing the back has to immediately place fresh leads. We don't want to lose. Track proning can trigger an arrhythmia, so it's very important not to lose time of ECG monitoring for too long. So the person facing the chest removes the leads. Person facing the back places on leads. Remove all any tubings crossing the chest and the front surface, and then you turn the patient over. So remove the lead, reattach the lead, finish turning the patient, reposition the patient to the center of the bed. Suction. Now, like I told you, proning will cause a lot of drainage of secretions into the tube. So you want to immediately be ready to suction. In COVID, please be careful. Use inline suction. Make sure it's a closed system. Avoid tube disconnections. Confirm that the airway is not kinked, that it has not migrated, and that there is no endobronchial intubation that has happened. So once proned, what are the... can I have the video, please? Mr. Girish, can we have the video play, please? Right. So you can all see the video. This is a short video that will show you the proning process. They are doing the first part, which is the horizontal movement of the supine patient. What they do with the arm is very important. They quickly tuck the arm, which is going to be under the body. See, can you see? The patient is going to be turned to the right side. The opposite arm is tucked under the body. They will now place a sheet, like you can see now. They will place a sheet over the part of the bed from where the patient has been moved. Now, this is part 2, that is from supine to prone in the lateral decubitus. You will see they will now rapidly remove the chest leads and place fresh leads on the back, clearing the chest before the final part of proning happens. Like you can see, the person on the head end of the bed has not moved their hand from over the ET tube for the entire duration of proning. This is the third part where they complete the proning. The patient is now fully turned onto her chest and the proning has been completed.